So thanks to everybody for joining us. My name is Sarah Van Gertruden. I'm the Executive Director of the Partnership to Improve Patient Care. Anyway, we're very excited to have everybody join us today for our PCORI Advocacy 101, the politics and policy of PCORI's creation and reauthorization. In this discussion, we hope that we are able to provide a big picture overview of how PCORI was created and its evolution, but also, to the extent that you have suggestions when this is over, we're more than happy to take some suggestions for future webinars that we should be hosting to help everyone maximize their ability to be good advocates for PCORI. Also, just wanted to point out that if you look to the bottom left of your screen on the computer, you do have the ability to type in a question. I do have Andy Rosenberg here in my office helping me to keep an eye on those questions so that if we have some time at the end, I'll get to as many as I can, and then to the extent that I'm unable to get to any of your questions, we'll try to make sure that we get you answers in writing. So I'm going to start moving now through the slides. So first on the agenda, we want to talk about the creation of PCORI. For those of you who are not aware, the Partnership to Improve Patient Care, or PIPC as we refer to it, is a coalition of organizations that came together to support the creation of a comparative effectiveness research institute. When we were undergoing this effort, clearly there were concerns on both sides of the aisle about what that would mean and how it would be implemented. So hopefully this will be a good backgrounder for you so that you can understand some of the issues that will be in play as PCORI moves closer to the date that it needs to be reauthorized. And then we'll be ending, of course, with some tips for how you can be better advocates to preserve PCORI and make sure that it sustains into the foreseeable future. So first we'll start with the creation of PCORI and the recognition, at least in Washington, D.C. and amongst policymakers, for the need for comparative effectiveness research. So before PCORI, there were several bills that would have funded comparative effectiveness research starting around 2007. There was clearly an understanding that there was a need to better understand how to drive a healthcare system that looked at comparative effectiveness of treatments and systems. And so that's how we got started in 2007 with several bills on the Hill. Then PIPC was organized as a coalition led by Tony Coelho. Some of you may be familiar with Tony, that he was a former congressman, also the author of the Americans with Disabilities Act. He is an epilepsy patient himself, so he came to this discussion and to these issues with a very personal story to tell and a very personal interest in making sure that as we did comparative effectiveness research, it was geared truly towards improving healthcare decision-making for patients and ensuring that they get access to the care that they need as individuals, not just a standardized care model. So in the recognition that we needed comparative effectiveness research, Congress did pass the American Recovery and Reinvestment Act, also known as ARRA, which provided $1.1 billion for expansion of CER, comparative effectiveness research. It also called on the Institute of Medicine to recommend a list of priority topics that would be the initial focus of a new national investment in comparative effectiveness research. So the quote here from the Institute of Medicine is that the list provides a starting point for what the report says should be a sustained effort to conduct comparative effectiveness research. As this research initiative progresses, the priorities will evolve as well. So there were a lot of politics in play as this was happening. On the right, amongst some of the more far-right Republicans, there was a warning that there was little to stop the federal government from using this kind of research to figure out what medications or treatments achieve similar results for less cost. And when that happens, according to members like Senator Pat Roberts from Kansas, it won't be long before Medicare starts rationing care. So one of the concerns that that folks had in that on the right was clearly this drive towards a one-size-fits-all healthcare system that would potentially get in between patients and their doctors in terms of decision making. Then when you look on to the left, a lot of the Democratic members were looking at doing comparative effectiveness research as a government-run initiative. Particularly, a lot of the bills that were coming up at that time were placing comparative effectiveness research within the Agency for Healthcare Research and Quality, also known as AHRQ, as opposed to having it be an independent institute. It was going to allow for, some of those bills had it drafted so that they would allow for cost comparisons of different treatments, and using that cost effectiveness data then to be translated into coverage decisions within Medicare and Medicaid. That drove some significant concerns again towards how do you balance the need for comparative effectiveness research with also this drive toward personalized medicine and the need for individuals to have access to information that will help them make more individualized care decisions based on their own personal needs, which may differ from what works for the average patient. So then we get to how PCORI became patient-centered. Senator Max Baucus from Montana and Senator Kent Conrad from North Dakota introduced the Comparative Effectiveness Research Act in 2008, which evolved into the Patient-Centered Outcomes Research Act of 2009. It was ultimately passed as part of the Affordable Care Act as a compromise between the right and the left. So although the Affordable Care Act was perceived as being, I think, a partisan effort, the piece of that, which is PCORI, was actually relatively bipartisan in the context of that bill. And Republicans a lot of Republicans did have a significant hand in drafting it. So some of those key statutory elements that made it bipartisan and made it patient-centered were defining comparative effectiveness research as comparative clinical effectiveness research, precluding PCORI's research as the sole source of a Medicare coverage decision, banning the use of quality-adjusted life year measures in Medicare. So, and that's something that I think is important, that you'll notice that PCORI doesn't use quality-adjusted life years to determine the value of any particular treatment. It also made PCORI an independent institute outside of government agencies and gave 2 seats to patients and 1 seat to a consumer on its board of governors. Also, explicit in the text of PCORI statute, it states that patient needs, outcomes, and preferences and subpopulations are to be studied. It also provides support for patient and consumer representatives and provides authority for PCORI to create advisory panels to help them do meaningful stakeholder engagement. So next I want to talk a little bit about PCORI's implementation and building support, improving healthcare and realizing PCORI's patient-centered mission. So PCORI in its early years, in its early years, PCORI did look a little bit like NIH, admittedly. I think as culture change takes time and is not easy. So in the early years, they were doing more researcher-initiated studies. They had broad priority areas, and they didn't really have a lot of advisory panels at the time. I think the good news is that PCORI really has evolved and progressed significantly since its early years to really achieve its patient-centeredness mission as it's outlined in their statute. The GAO back in 2015 determined that PCORI is meeting its legislative intent. And some of the examples of that are that they have advisory panels in place. They have shifted from purely researcher-initiated topics of research to doing more targeted funding announcements. They are doing stakeholder roundtables to determine their research priorities. And at those roundtables, they have a strong patient presence. Also, patient engagement at PCORI is taken very seriously. They have engagement officers that enforce patient engagement in their contracted research. And as somebody who sits on one of PCORI's advisory panels, I can tell you we spend a lot of time putting together a patient and family engagement rubric that helps researchers understand what it means to engage patients in research in a meaningful way. So those advisory panels are doing real work, and it's having real implications within PCORI's research. Also, PCORI is funding what they call engagement awards and pipeline awards. Those awards have made a tremendous amount of impact on building the infrastructure for doing comparative clinical effectiveness research. With those engagement awards, there's a lot of work being done to help patients get educated about what it means to participate in research, also to help determine the topics, consensus around topics that represent gaps in the research that need to be prioritized, pipeline awards that help patients then connect with researchers. I know a lot of you are involved in some of those awards, so I think this is a significant progress in terms of PCORI's patient-centeredness. And then, of course, PCORNet, which has been, I think, one of PCORI's chief and most, it's been, I think, a real positive direction for PCORI to create this infrastructure for doing research that will hopefully live in perpetuity. So politically, one of the things that's been very important is to sort of keep PCORI distant from repeal efforts. As many of you know, since PCORI was passed in legislation in 2010, there has been a tremendous amount of work here on Capitol Hill to repeal the Affordable Care Act. Now, as the Partnership to Improve Patient Care, PIPC, we've stayed very much in contact with a lot of those congressional allies that support PCORI, but it's important to also realize that every year a House and Senate Republican have unsuccessfully introduced an amendment to eliminate PCORI. Members like Senator Pat Roberts refer to PCORI as one of the four horsemen of Obamacare, and that's with the IPAB, the Centers for Medicare, Medicaid Innovation, PCORI, and the USPSTF, the Preventive Services Group. And so, I think it's important to kind of put it in that context. Also on the left side, there's the Center for American Progress, which has continued to advocate for cost effectiveness in Medicare and doing more cost effectiveness research to that end. But despite some of these more opposing positions, PCORI has not been included in prior reconciliation packages that would have repealed the Affordable Care Act. So that's the good news. But moving forward, because PCORI's authorization does expire in 2019, they are going to be facing heightened scrutiny and oversight. So because PCORI was passed in 2010 with a 10-year authorization, unless Congress acts, PCORI's underlying statute would expire in 2019, which would mean that its funding stream expires. So next I want to think a little bit about how PCORI supports the shift to value. So as many of you know, this shift from volume to value, how you pay for care that is valued by patients as opposed to just paying for volume of care provided, that is something that has significant bipartisan support. And so what I wanted to articulate here are some suggestions for how, as patient advocates, you could be doing you can be putting your personal story and your work with PCORI in a context that would resonate really well with members on the Hill who are going to be responsible for PCORI's reauthorization. So a few of those are that PCORI-funded research provides information that can improve individual health decisions. So really getting to the individual nature of health decisions as opposed to thinking about healthcare as what works for the average patient. And then patients viewing PCORI-funded research as credible and therefore reliable. This really gets to, as many of you know, there's a significant time lag between research and it being translated into clinical practice. To the extent that PCORI-funded research is viewed as credible, the hope is that it would then be used more quickly and incorporated into health systems more quickly. PCORI also has an evidence synthesis initiative and dissemination strategies that will ensure patients and providers can access information on treatment options and their value based on personal characteristics, needs, and preferences. I think this is a really important point too. So to the extent that you are involved in PCORI-funded research, to connect the dots not just to how important that particular body of evidence is, but also to how it's going to be disseminated into practice most effectively, and how it can be tailored to the individuals that will be using it. So how do we then tailor those dissemination efforts to individual patients, to their providers, and to systems in general? Also, PCORI's work tells us what information, including patient-centered outcomes research, should be incorporated into decision aids, shared decision-making tools, value assessments, et cetera. I think it's going to be very important, particularly in this shift to a value-based healthcare system, that we are using PCORI's work to make sure
Hi, everyone. Very sorry for the technical difficulty. Sarah's audio just dropped. We're trying to get it back online. Hold tight, and we'll rejoin the webinar in just a second.
Try reconnecting.
Hi. So I'm not sure if folks can hear me again. I apologize for.
I wasn't hearing that. I don't think anyone can hear you.
Sorry, we're having.
Sarah, do you mind trying again for us? I think we might be back online here.
Oh, great. Can folks hear me now?
Yeah, we've got it. Thank you so much. Deepest apologies to everyone listening in.
So sorry. Technical difficulties. So to get back to the earlier slide, I think somebody had a question about the 2019 expiration of PCORI's statute. So in 2019, unless Congress acts, PCORI's underlying statute would expire. So that means that it would not have funding after 2019, assuming that Congress does not act. But if Congress acts, obviously, then its funding streams would continue. And so I apologize for the sound challenges. So moving into the next slide about how PCORI supports the shift to value. I think on this slide, we just wanted to really emphasize how important it is for us to be connecting the dots between how we shift to a value-based healthcare system that achieves outcomes that matter to patients and how PCORI fits into that. And that's going to be largely about how PCORI's research answers questions that matter to patients, and then how that information is then translated effectively and quickly into health systems. So thinking about PCORI as a role model, I think this is also something that we have found resonates really positively on Capitol Hill. PCORI has created an infrastructure for patient engagement that is really just light years advanced to other both government agencies and I think other research institutions in general. So it's very important to talk about how much PCORI is influencing the culture of research and the culture of healthcare in general by emphasizing the importance of patient engagement. So I know one thing that we have done is talked about, their infrastructure as a model potentially for CMS and CMMI in terms of healthcare systems, the FDA's patient-focused drug development program, quality measurement, so to the extent that PCORI is identifying outcomes that matter to patients as part of its research, how important that could be then to determining what outcomes we should be measuring in terms of quality measurement as the determinants of success. Also, if you look at industry, we keep hearing more and more about how industry is hiring patient engagement officers and making that a priority. Even in congressional committees, with all of the work that's going on around healthcare these days, there's been an emphasis on trying to do listening sessions with patients and consumers and people with disabilities. And I think that probably the most important component of where we see patient engagement being modeled is within the research community. There has been significant progress in changing the culture of research so that researchers genuinely appreciate and value the patient voice in both putting together the research question and identifying the outcomes that will be measured as part of the research, and keeping patients engaged throughout the process and hopefully into dissemination, which is obviously the piece that's to come. And so lastly, I just wanted to talk a little bit about, in terms of advocacy, which I know is probably the piece that you guys are most interested in, wanted to talk about how we advocate for PCORI effectively and make sure that your voice is heard in Washington. So patients are PCORI's #1 constituency, and it's important to also realize that patients are constituents for every member of Congress. So to the extent that you as patients or your members as patients see PCORI as valuable to their healthcare decision making, policymakers will listen. It is going to be it's going to be very important for us though to connect the dots to how PCORI's work then drives care that patients value. So one thing that I want to emphasize in this discussion is how important it is for you to be compiling your stories, putting them in a context that will resonate positively on Capitol Hill in a bipartisan way. We do believe that PCORI's reauthorization can and should be very much bipartisan, and it will be incumbent upon all of us to make sure that we're telling those stories effectively. And then in terms of tactics to reach policymakers, after this is over, we'll be sending to you a link that you can use to reach out to your individual members of Congress. But I think, there's a lot of different ways to reach your policymakers. It could be, if you're coming to DC, that you can meet with your member or with their congressional staff. If you are not here in the Capitol, You can brief your member or their staff in their local office. You know, I think sometimes actually meeting with the staff and the members in the local office provides an opportunity to get their ear in an environment where they're not so pressed for time. They probably can spend a little bit more individual time and ask more questions when they're in their local offices than they can and do here in DC. You can also write a letter to your member of Congress explaining the personal value of PCORI-funded research for you and your loved ones. You can also reach out to all of the teams that you work with to write letters and help broaden the base of support. And I think most importantly, too, is to educate others about PCORI and make them ambassadors. You know, the ambassador program that PCORI has set up, I think, has been a very effective way to get out into the grassroots and outside of the Beltway to really help people understand why it's important to engage in research and what that research means. And another thing that you can also do is to just stay in touch with us here at PIPC. You know, we really do value and appreciate that, you know, we don't always know everything. And so to the extent that you have suggestions for ways that we could be weighing in, ways that we could be doing more outreach in your communities, you know, we really do appreciate that kind of input because ultimately, you know, we're here to make sure that this kind of research continues, that it gets done. We believe that PCORI is a prime example of how you can really institute culture change, not just in research, but I think throughout the healthcare system. And PCORI is leading the way. And frankly, you're leading the way because a lot of you, I know, have worked directly with PCORI. And it's those examples that you provide that are making the difference and that are showing policymakers what the impact is on the ground and in real life. You know, we talk a lot about real world evidence, and I think, you know, that's what we hope that PCORI brings to the table for members of Congress is to say, you know, we are the example of where real world evidence that can be used effectively and immediately will make a difference in people's lives and in the healthcare system. So with that, I don't know if we have a few questions that folks want to ask. I've got Andy with me to help me run through some of the questions that I've seen thus far. Andy, what do you?
Very good. Thanks, Sarah. Well, first, I just want to remind everybody who's a number of folks wanting to know whether or not these slides are going to be available afterwards. And I want to encourage listeners to go to our website, which is pipcpatients.org, where we will be posting everything that Sarah has spoken to on that website. So and there's a lot of great information there as well. We really want to encourage you to visit that for the slides. Sarah's got a couple of questions here. Sherry Sprung asks, when is the authorization deadline?
So PCORI's authorization expires at the end of 2019. So it would, so in terms of reauthorization, we would expect that over the next 2 years, you know, so I think we were gearing up this year for a potential fight related to PCORI if it was part of what's called the reconciliation effort to repeal the Affordable Care Act. At this point, PCORI is not included in that. So in terms of the deadline, right now it remains the end of 2018. But you know, if PCORI were to become a target in terms of the repeal and replace effort of the Affordable Care Act, you know, one of the things we hope is that you'll stay in touch with PIPC because we will then be sending out alerts and helping everybody to gear up to reach out to their members of Congress in a more immediate way if that happens. At this point, it hasn't.
And along the lines of that question, Sarah, is there a one-page description of PCORI that can be used when folks talk to their legislators?
Yes, we have that on our website, and we'll include that then in the follow-up email to everybody who is participating along with the slides.
And then does PIPC, or I guess the question was really, does PCORI suggest, but I guess what they're asking really, does PIPC suggest or provide any asks for those meetings with their congressional reps and senators? And the reason I ask is PCORI can't lobby, right?
Right.
So this person also calls in Gary Sherwood says he recommend getting to know which committees your member of Congress serves on.
Yes, so in the Senate, it's the Senate Finance Committee. That's the committee that has jurisdiction over the Patient-Centered Outcomes Research Institute. On the House side, it would be the House Ways and Means Committee and the Energy and Commerce Committee, which they have dual jurisdiction. And so, yeah, so that's a very good question. So to the extent that you have a member of Congress in your district or your state that serves on one of those committees, those are very important members to know the value of PCORI. I would also argue that the Senate Agency Committee could also be a really good, although those members don't have direct jurisdiction, they're very involved in healthcare. So that would be helpful as well.
So here's another question, Sarah. We often talk about PCORI and how we're approaching research from a patient-centered perspective. Do you have any recommended slides that they can use with regard to that? Are there slides or around patient-centeredness and what it means?
Yes, so on our website, we actually have some principles of patient-centeredness in research that I think would be very helpful. We also do talk about that too in it's not a one-pager, it's a two-pager, but the two-pager that we'll be sending around that's useful for advocacy efforts also is helpful in that regard in terms of putting some meaning behind what it means to be patient-centered. And this is a really good question, actually, because something that we've talked about a lot here with PIPC is that the term patient-centered gets used a lot, particularly amongst policymakers on Capitol Hill and the agencies. But in terms of having meaning behind it, what does it mean to be patient-centered? I think that's a very good question, and there have been a lot of efforts to define that term. And so maybe as a follow-up to this, we'll send around some information that can help you talk about what it really means to be patient-centered in research, particularly, to help you talk about PCORI in that context.
Sarah, another interesting question Regina asked is talking about the jobs that are brought to a given state as a result of a PCORI grant, a line of argument that resonates with members of Congress. Is there a jobs angle to any of this?
Yes, I think so. You know, if you can quantify that, I think that's a very effective message for members. Particularly, you know, infrastructure is something that Congress is definitely talking about right now. You know, I mean, it's considered to be more, you know, building bridges, that kind of thing. But I do think that members are focused on what it, you know, on keeping and creating jobs.
Another question, Sarah, do you have any suggestions for how to best present one's personal stories for maximum effect? How effective can a patient's or a person's personal story be in advocating for this?
Oh, I think the personal stories are the most important. You know, there are a lot of folks who can go to the Hill and talk about the big picture of PCORI in a manner similar to what we've done today, but I think that the personal stories are what really make the difference. And when you are meeting with a member, whether it's here in DC or in their district office, and you explain, here's the research that we're doing, here is the impact that it will potentially have on me, my loved one, I think that makes a huge difference. And I think that the patient engagement component is also very important, to explain to members that PCORI is different from existing research institutes. That PCORI, because it has a patient engagement component, therefore is asking the right question and is measuring the right outcomes that make a difference in terms of how people ultimately will make healthcare decisions. So if you can put it in that context and make it very personal, I think that is probably the most effective thing you can do to differentiate PCORI from others.
So Sarah, related to that, and these are two other related questions. Lawrence asked, what's the best way for PCORI, he calls them ambassadors, but for champions of the program, of the effort from a particular congressional district or state to coordinate their lobbying efforts, and is PIPC involved in any of that? Do they have lobbying days or lobbying events that are aimed on Capitol Hill advocacy that folks can participate in, Were there any efforts that you know of that are aimed at the state level to drive support?
So at this point, because PCORI has not been a target of the repeal and replace effort, we have not put together a lobbying day, although it is definitely on our radar that we will want to do that in the future. And just to explain, the reason that we have not had a lobbying day specifically around PCORI is frankly to keep it off the radar in terms of these repeal and replace efforts. You know, I don't think there's anything wrong with being out there talking about your positive experience with PCORI at the individual level. I think, in fact, it's better to be out there doing that now. But I don't necessarily, we have made a political assessment that it's best not to be doing like a large concerted lobbying day quite yet until we get through this repeal and replace effort, just because we don't want to raise PCORI as a potential target.
Makes sense, Sarah. So there are a couple questions around confusion that some folks have about reauthorization versus appropriation. So just to clarify, if there's no reauthorization, will things wind down after 2019 and suddenly, if there are unused funds, can they still be used? And then along those lines, you know, is there any risk of losing a portion or any of PCORI's claims to either the PCOR trust fund or the PCORI fee from insurers before 2019?
All right, so let me answer the first question first. So in terms of after 2019, while PCORI would not be getting any additional funds out of the trust fund, the money that they have already obligated, they would be able to continue to pay out. So I think there's a chart at the end of the two-pager that I'll send around that shows how that funding would then be tapered off to finish the projects that have already started. But there would be no new projects started after 2019. And then in the second question about those claims to the PCOR trust fund, my understanding, I mean, at this point, unless Congress legislatively eliminates the fee from insurance plans into the trust fund, unless that happens, PCORI will continue to get the money from that trust fund. So we haven't, well, and probably what you're referencing is that there has been some efforts from the payers who are the health insurance plans, which there's a $2 per plan fee that goes into the PCORI trust fund that sustains PCORI's funding. That's where the funding comes from. And so there have been some questions about whether that would be part of the repeal and replace effort. We at this point do not think that it will be, but if it does become a target again, we would be reaching out to all of you most immediately to be advocates and to start advocating immediately.
And so just to clarify, Sarah, is PCORI able to fundraise in any general sense? I mean, are there other sources that they could use or go after to stay in business even if there was no further government support?
That would require a change to PCORI's underlying statute. As of right now, no. Because of their 501c, and I'm sorry, I don't know the full acronym, but the way that they are structured right now, PCORI is not able to fundraise, as the question put it. That would take a legislative change in order for PCORI to be able to do that.
So currently, the last question we have here, what would be the last round of RFPs that we expect PCORI to accept at this point? We know that was the question that came in. Like, as far as we know right now, we're good through 2019, right?
Yes.
So I guess that question is whether or not RFPs are going to be accepted as far as we know through 2019, presumably. Or do we not know that?
Yeah, I mean, I would have to ask PCORI exactly how that works in terms of its, in terms of how they sustain the funding for an existing award that was provided in 2018. So
yeah, so if there was a 3-year grant in 2018, does it end in 2019, or does it continue until 2019?
yeah, I mean, my understanding is that to the extent that PCORI has obligated funding for a project, that it would be able to finish the project.
Mm-hmm. Another question, they keep coming in, Sarah. I know they're getting a little specific. We currently have a Tier 1 community award and are well on our way to Tier 2. We have strong stakeholder, local, state, and national support. The question of engaging these stakeholders to continue on to Tier 3 is now in question. Is that right? Because this would pose a huge handicap for them in future work.
No, I mean, again, our hope is that PCORI gets reauthorized. So I think to the extent that if PCORI does get a reauthorization, that would potentially put them, they would be continuing them for another 10 years. So, as I said before, right now, PCORI will continue to outlay funds for, in the manner it does now. I mean, I'm sorry, and Andrew, anyway, sorry. So if we could, and I'll try to get some better answers to some of these more specific questions directly from PCORI, because some of these questions are really more geared towards them in terms of how their funding streams would work in the event that they were not reauthorized. But I think, for purposes of this webinar, we're assuming, I would assume that it's good to continue to do this work and to move into the Tier 3, assuming that PCORI does get reauthorized.
There's another specific funding question, Sarah. I don't know whether or not you know about PCORNet's now helping to fund many CDRNs and PPRNs. Do you know what happens to this support when and if PCORI were to go away?
So I think from PCORNet's standpoint, if, and I'll have to, again, that's probably a follow-up with PCORI, just talk about specifically what their plans are with PCORNet. So I think it's probably best to direct that question back over to PCORI.
And I'll say, we're getting a couple other questions, Sarah, that are very specific around proposals that are being submitted, RFPs or grant proposals. If anybody wants to email you with a question, we can make sure to get that to PCORI, right? And get
I think for some of these more specific, more PCORI-directed types of questions, yes. I mean, if you want to send them to me, that's fine. And what I'll do is I'll just send them back over to PCORI for answers from them. But if you have any questions that are more related to the politics and the advocacy, please, direct those to me. But you can direct them all to us, and we'll make sure that we get you answers, whether it's from us or from PCORI.
And I think that's all right. One last question. This will be the last one, Sarah. So when we talk to congressional members, should we just ask for their support of PCORI and not ask about being a sponsor for a bill to reauthorize PCORI? How specific do they need to get?
Yes, at this stage, I think that's absolutely right. I think at this stage, because PCORI has not been identified as an immediate target in 2017, the goal is simply to tell your member of Congress your positive story. Make sure that when they hear the word PCORI, that it resonates positively to them, so that, I think in that way, PCORI is less likely to become a target. Now, there will come a point in time where it is appropriate for us to be talking about, particular legislation, but we're not there yet. Because PCORI currently is authorized through 2019, there is no need to be driving any particular bill at this point. So we'll be, and that's another reason that please stay in touch with PIPC, and we hope to be able to help walk folks through that process as it happens. But right now, I think the important thing is to be telling the positive stories to members, so that over the next 2 years, when PCORI comes up, members go, aha, I know what PCORI is. I've got several constituents that participate in PCORI-funded research, and they talk really positively about it. And so that's, I think, ultimately our goal, is to create a very positive impression of PCORI on Capitol Hill, so that members understand that it's having a positive impact on their constituents.
Sarah, I think that brings us to the end of the questions, and we're 45 minutes in, so maybe end a little bit early with any last thoughts.
Well, and I appreciate this, and I apologize that I'm not able to answer some of the more PCORI-specific funding questions, but you know, I do hope that this was useful to everyone in terms of thinking about how to be positive advocates. You know, if there is anything that we can be helpful with in terms of if you're in DC and you don't, you know, you need help with the process of meeting with your members of Congress, please feel free to reach out to us. You know, we can help you identify, you know, who your members of Congress are, which staffers you might want to try to schedule some time with. We can certainly arm you with materials to take with you to those meetings as well that provide background about PCORI. And I think again, the most important thing is for you to be telling your positive personal story. And that I think just makes all the difference in the world.
Great.
Great. Well, thank you very much, everyone, for joining us today. And we will be taking, you know, always happy to respond to your questions. And if you also have comments about future webinars and information that we could be sharing with you to help you, please send that my way.
Thank you. This concludes the call.